Capitol Report is a production of Senate Media Services.
On this week's program, we'll hear about the 2017 goals of the House DFL Caucus and meet their new leader. We'll also dig into some of the recommendations from the Governor's Task Force on Mental Health. Stay tuned for this and more on this week's Capitol Report. Following the 2016 election, House Minority Leader Paul Thissen announced he would not seek re-election as the House DFL Caucus Leader. Joining me now in the studio is the newly elected House Minority Leader for the DFL Caucus, Representative Melissa Hortman. Welcome.
Thanks for having me.
Congratulations on your election. The Star Tribune did a recent profile on you, and they called you persistent. Is this a fair characterization?
I think so. You know, I think what they were really focused in on is that it took me 3 times to get elected to public office. And this is something I think you see throughout history. People who run for office often have an unsuccessful go and then get elected in their 2nd or 3rd election. So I ran in 1998 when Jesse Ventura was on the ballot, and it was really a wave election that year. A lot of people kicked the covers off in the morning and said, I'm going to go vote for the wrestler. And they tended to vote for men in the suburbs, so we had some fantastic women who had been serving in the legislature for quite a while who lost that year. And it wasn't a good year for women in the suburbs to get elected. So then the second time I ran was in 2002, and when Paul Wellstone's plane went down, that really changed everything.
I remember that.
The memorial and, you know, the late add to the ballot of Walter Mondale. So that was another, it turned into a wave election. It was really kind of surprising how it all played out. And I thought I was done running. I thought, you know, the voters had 2 opportunities to hire me for this job, and they decided to hire a different candidate. And so I'll do other things. But it's really my passion. I mean, since I was an 8th grader in middle school, and I thought, wow, look at John F. Kennedy, the amazing things he did as president. And so when you have a passion, you have to be willing to take some setbacks and keep fighting for your dream.
And so you have a really interesting perspective then, because you've kind of seen wave elections, and we have just experienced a wave election.
We really have. You know, I think for candidates who lose in years like this, it's really hard because you put yourself out there as a person, and you're giving people a chance to accept or reject you as a person. And so it can be very hurtful when you put yourself out there and you really go all out, and the voters don't opt to hire you for the job. But I think it's really important for candidates to keep in mind that elections are about bigger things than them personally. They're about national waves, they're about state waves. And so nobody should take it personally if their first foray in running for public office, they don't make it.
Last week we had the November budget forecast, and you and Speaker Dowd actually agreed on something. You both spoke about the importance of Minnesota families and their pocketbooks. Can you say more about what your priorities are to help Minnesota families?
Sure. You know, I think that all people who run for office have that same thing in common. We all think we can make Minnesotans' lives better, which is why we take the chance of running for office. So I think one thing I'm hoping in the next 2 years is that we'll focus more on the things that we have in common as public servants and less on the things that divide us, because we really do have more in common. The things that we specifically in the DFL House Caucus have fought for Minnesota families are more affordable higher education, more economic development in parts of our state that aren't doing as well as other parts. So whether that's the Iron Range, or whether that's North Minneapolis, or some of our agricultural communities who are at the mercy of the world commodity markets, that we think about economic development, but then also working families. You know, when I was a young lawyer with 2 children in daycare, I was at the Legal Aid Society, and my take-home pay was $1 an hour after I paid for daycare and dry cleaning and parking. And so for a lot of families in Minnesota, how much childcare costs and how good childcare is really impacts their quality of life. So those are issues we care about, we've been working on.
We had Senator Wickland on this program recently. She was the chair of the task force, or legislative task force, that was looking at affordable access to childcare. And this is a crisis across the state. Workers are leaving the field, and there's not enough spots for people. Do you have some ideas about how we can address this at the legislature level?
Well, I know we have, I believe it is a 6-year waiting list for people to get child care assistance from the state. And I think one of the things about Minnesota is we have a very good work ethic in our state, and we have a lot of 2-income families. So people want to be working And the lack of affordable childcare is getting in the way of people finding and keeping the good jobs that they want. So with a budget surplus, it seems to me that we could invest some in Minnesota families by making more state-supported childcare available. It doesn't mean that we're paying for people's childcare, but it means for lower income families, we're making it easier for them to find high quality, reliable daycare.
And you have experienced, or are experiencing this personally, the cost of higher education. Is your caucus developing some ideas about addressing college affordability?
Yeah, we'll be meeting soon as a caucus to sketch out our detailed agenda for the session. But it's fair to say that we have consistently worked towards tuition freezes and increased student aid and debt relief. There's 3 different ways to get at the problem. First, when you do a tuition freeze, you know, our higher education institutions don't love that. It only works if it's fully funded and they don't have to tap the students for what the state doesn't provide. But the thing about a tuition freeze is we have to get at the rising cost of higher education. It shouldn't outpace inflation. And that's part of what's making it hard for families. I don't think we can go to the public year after year and say that the only solution is increasing student aid. We need to expect our higher education institutions to tighten their belts as much as they can. And then second, we do look at student aid because that allows us to direct the aid to the students who need it the most, whether it's targeted fields or whether it's income-based. Student aid is a way for us as a state to sort of fund the students who need it the most. And then debt relief. There's a lot of people who've already graduated from college. In the last 10 years, the cost of college skyrocketed, so we can't leave those families behind. We need to help them pay for their debt.
One last question, and you touched on this a little bit. 60% of the Republican majority represent rural Minnesota, greater Minnesota. So how will you work to find balance between the interests of greater Minnesota and the urban areas who have different interests?
They do have, you know, in some areas they do have different interests, but in way more areas they have the same interests. Working families are working families anywhere in the state. So if you're a family in Minneapolis and you want to send your kid to college, it's expensive. If you're a family in Two Harbors and you want to send your kid to college, it's expensive. So I think the things that we're working on are things that help Minnesota families across the state. The things that we'll be looking at that help greater Minnesota in particular are things that are not new for us. We have worked hard on for several years. We've done great local government aid for greater Minnesota. The DFL has fought hard to get more broadband. You should be able to have a technology job and sit in your house anywhere in the state of Minnesota and be able to be a part of the workforce. And so broadband is a big part of that. And then looking at economic development opportunities for areas of the state that are dependent on international commodity markets. So our Iron Rangers are in this boom and bust cycle, which we don't, as Minnesota legislators, control. If we got rid of every environmental regulation and we made electricity free for the taconite mines, we still would be at the mercy of the Australians putting iron ore in the world market and the Brazilians putting iron ore in the world market. So it's our job as state legislators to develop other economic pathways to success for an area like the Range. And clearly we've done some things that are good, the Delta Service Center up there, but we need to do more work because people should be allowed to stay in their community even though the world economy is changing.
Representative Hortman, it was so nice of you to take the time. Thank you for coming.
Thanks for having me.
Marking that infamous day 75 years ago, the Minnesota History Center held a ceremony to remember the attack on Pearl Harbor.
We're here today to commemorate the heroism of the American soldiers, sailors, servicemen, airmen who fought so valiantly in face of that dastardly sneak attack on December 7th, 1941. We're here especially to honor the 2 Minnesotans who were there at that time and who served heroically on behalf of their state and their nation. I'm told they were both fairly new to the military at that time. Mr. Thill, you said you had served for just a couple weeks training in Lake Superior, which doesn't provide exactly the preparation you want for the Pacific Ocean.
Governor Dayton declared December 7th to be Pearl Harbor Remembrance Day and offered framed proclamations in recognition of heroic service to 2 surviving Minnesota men who were there that day.
I never did see the flag go to the top of the pole because the planes came in at 5 minutes before 8, and it seemed like the sky was full of planes, and they carried out their attack on the battleships, but they never, ever touched the submarine base. We were very fortunate on that condition.
I'm not used to speaking like this, but I'll give it my best shot, like we did at Pearl Harbor. I'd like to tell you the story about the ward. A captain on our ship at Pearl Harbor was only captain 1 day before Pearl Harbor. He was brought out on a boat to our ship to take command. And of course, when he saw this submarine that was on this restricted area outside the harbor mouth, he decided he was going to ram it. Then he got to thinking about it. He told us about this later on in life. He said, well, I better not, because I'd probably ruin my ship. It'd be the shortest command in history.
The ceremony also included the 34th Infantry North Star Brass Quintet, performing the service song for each branch of the armed forces. More than 250,000 adults and children in Minnesota live with a mental illness. In the spring of 2016, Governor Mark Dayton established a task force on mental health to look for ways to improve mental health services across the state. Joining me is the Assistant Commissioner for the Department of Human Services, Claire Wilson, to talk about the recommendations of that task force. Welcome.
Thanks for having me.
This is a very complex problem, and it was interesting to me that there were meetings held throughout the state. So there was a lot of intentionality in that. Why was that important?
Really, moving around the state was critical, the task force felt, to really understanding the experience of Minnesotans across the state as they experience the mental health system. You know, if you have a heart attack in Rochester or you have a heart attack in Crookston, you're going to be treated essentially the same protocols are going to be followed. It's very different if you experience a mental health crisis. Your access to treatment may be different depending on where you are in the state. The protocols may be different. There's real variability by region. So it was important to the task force that they get out and really hear from people with lived experience across the state, as well as providers and counties and others who are delivering the services.
The first recommendation surrounds the continuum of care. What is happening today with the delivery of care for the mentally ill, and what needs to occur?
You know, right now we have a system that is really focused on the high end of the spectrum. So we've really invested a lot as a state in intensive interventions.
So people that are like really
really sick.
Okay.
People whose mental illness has not been addressed early enough to prevent them from ending up in a mental health bed rather than a jail cell. Mm-hmm. So really looking at the continuum means thinking about how do we invest in promotion and prevention of mental wellness? How do we really think about transitions between levels of care? So when you're discharged from treatment, what does it look like for community supports? How do we build up community supports? And how do we ensure that we're really creating a system that intervenes from early onset into resiliency and recovery?
There's increasing understanding of the role that trauma plays in mental illness, most publicly with soldiers returning with symptoms of PTSD. But it isn't just soldiers, it's refugees and it's people from cultural groups that have experienced trauma. One of the recommendations talks about a cultural lens to reduce mental health disparities. So how does that work?
I'm really glad you framed that question that way, because the task force did hear from many communities of color and refugee communities that the impact of trauma on their experience is profound. And the system as it's currently developed has not necessarily addressed those experiences in a way that's been culturally proficient. So this is Minnesota. Our demographics are changing drastically, and we need cultural providers. We need treatments that are responsive to the needs of the ways certain communities experience and even define mental health or mental illness. And so really the task force prioritized ensuring that our system continues to be culturally responsive and is built on some of those principles.
And how would that work? Is it more training for those working in the field to understand the cultural background of the people they're working with?
It's both recruiting and training current providers, as well as expanding that workforce to include providers who look like the communities they're serving. It's creating more opportunities for people with lived experience to engage in the system as peer support workers, as community health workers, or cultural liaisons. And then it's also just looking at different barriers in the system that create more challenges for communities of color to access treatment. So longer diagnostic assessment times, or not enough of a sustainable rate structure for culturally specific providers to survive. So it's various ways of looking at it.
One other aspect, the death of Prince highlighted the epidemic of opioid abuse in Minnesota. There are those, it's not just the opioid epidemic though, it's also alcohol addiction. And so regardless of the type of addiction, it pervades all levels of society. So how do we work towards parity in treating that? Treatment is very expensive for addiction.
That's right. You know, the task force recognized that you really can't talk about mental health without talking about chemical health, that there's such a high frequency of co-occurring. And the task force also really looked at parity and ensuring that treatments are covered by both private insurance and public insurance, and that there's parity in the ways that those are both paid for and accessed. So there were strong recommendations that the Department of Commerce look at network adequacy and look at what's currently being covered in the private and the public market, and make sure that those treatments are treated the same as any other healthcare issue, which really essentially we don't want policy that reinforces stigma. We want to recognize addiction as a disease and treat it as such, both in the way we pay for the services and the way we develop them.
Another recommendation is to achieve housing stability. Can you explain the relationship between mental health and having stable housing?
You know, the task force heard everywhere that it went that housing stability was key to mental wellness and to really ensuring that people can live into recovery. It's also one of the biggest challenges to achieving recovery. You know, when people are experiencing mental illness, they are experiencing disruption in their personal lives. They may go in and out of treatment, so it's difficult to attain stable housing. When they come out of treatment, they may require additional supports to live successfully in the community. So medication management, or help getting to different appointments, or just support in living skills and being successful at sustaining life in the community. So achieving stable housing and achieving housing with supports is really critical. It's a critical part of the mental health system that sometimes gets not included in the conversation. So the task force made it a priority to include it as a recommendation.
Well, and just having that stable housing, then that would go towards the continuity of care.
Absolutely.
Yeah. The state is facing a projected worker shortage, and caring for people with mental health issues is demanding work. What steps can the state take to make sure that we have the workforce into the future facing the possible shortage of workers?
That's a great question, and all of these recommendations hinge on a workforce to implement them. And so it really is a collaboration between multiple state agencies and educational institutions and providers to make sure that we're both recruiting providers into the system, ensuring that we are, you know, reimbursing mental health services at a rate that is attractive to people to want to come into the system and work there. And then also that we're retaining those folks, that people who get trained in Minnesota stay in Minnesota, and that they see a clear career path. So they come in to, you know, as a clinical trainee and see a clear path into psychiatry or another field, you know, another area of the field that resonates with them. But it really is recruitment, training, retention.
Ms. Wilson, I want to thank you so much for your time today.
Absolutely, thank you.
Joining me now in the studio is one of the members of the Governor's Task Force on Mental Health, Representative Roz Peterson. Welcome.
Thank you.
When I was growing up, mental health had a really negative stigma. So has that improved? Is it easier to talk about mental health today?
Well, I do think it is a little bit easier because mental health has no discrimination. It affects all different income levels at every race and every age group. And so I think that you find that I think every one of us has been able to be touched positively or negatively in some fashion with mental health issues. And so I think that some of those barriers are being dismantled, although I won't say that they're completely gone. There certainly are still issues that we're dealing with.
From your perspective, do you think mental health challenges are on the rise, or is it possible that we as a society are just that much more aware of it now?
I think it's a combination of both. I agree that it does seem that there seems to be more problems with mental health issues. In fact, suicide is the leading cause of death more than car crashes. And when you see statistics like that, you can only be concerned that there are things that seem to be troubling people in a greater fashion than they were before. However, I do think that there is more diagnosis and more treatment available for people who are dealing with mental illness issues and mental health issues.
For those of us who observe mental health from the outside, it really seems to be putting a lot of pressure on our law enforcement. There's also notably a lack of beds for mental health, and so often those people are ending up in jails. The legislature has looked at this issue. Does more need to be done?
It was great to have the mental health task force. So we had people from law enforcement, people in the mental health system. We had basically all stakeholders at the table. And so it was nice to be able to talk about a lot of these issues in a very open fashion and being honest with each other of what was working and what wasn't. One of the things that came out of the bed issue was that there seems to be a log jam where people don't necessarily need the hospital bed, but there was no place for them to go afterwards. So I think what we need to look at is how we can help streamline that process so that we can get the right health care at the right time for the right people. And that is the challenge with what we're dealing with now. And I do think that there is an appetite in a bipartisan fashion that we need to look at additional resources from that standpoint. In the last legislative session, there were additional resources added to mental health issues, but there's always more that can be done, and there's always ways that we can start looking at taking our existing resources and how we can apply them more effectively as well.
Did you look specifically at addiction? Because issues of addiction factor in crime, homelessness. I read one statistic that 50% of homeless individuals experience mental health problems, violence, broken relationships. Can the issue of addiction be addressed at the legislative level?
Addressing is one thing, but there's definitely a recognition that a lot of these issues are interrelated. There are many people who have mental illness that also have chemical addiction problems, and some that do not. There are some that get hung up in the criminal justice system and others that do not. So we really have to look at things more of an individualized basis and not necessarily have cookie cutter type legislation that puts everybody in the same box. And communities also have different resources as well. And being able to recognize the different resources that are available across the state is also difficult to just put in a simple law by, for example.
Right.
But I do think that we can work together in a more collaborative fashion so that we can make sure that all of those resources are integrated and working effectively together.
There's reportedly a high turnover rate for mental health workers, and Minnesota already has a tight labor market, and that tightness is projected to increase. So at the legislative level, what can be done to address the issue of worker shortage and burnout and salaries for those people charged with caring for people in crisis?
Well, it's a great subject that you bring up, and Sue Aberholden, who's the executive director of NAMI, talked about we can't do much more because we have a workforce problem as well, and so we really have to look at those workforce pipelines and make sure that people are trained properly and compensated properly so that we can attract good people to work in these areas too. They're difficult jobs many times, and a lot of times they're physical. And so we have to make sure that we have policies in place that not only can attract a quality workforce, but create a safe working environment for the individuals that are working in these areas too.
The 21st Century Cures Act, which has provisions addressing mental health, just passed the U.S. Senate, and President Obama is expected to sign it into law. So that bill has very broad bipartisan support. Do you think there is similar bipartisan support for addressing mental health issues in the state of Minnesota?
Absolutely, and we've even seen that over the past several years too, that we have people on both sides of the aisle recognizing that if we can help work on some of these mental health issues, that it will have a trickle-down effect or trickle-up effect with families and how they're working together. We heard a lot of testimony of how our system is broken. It's a lot better than a lot of other places, but areas that we certainly can do better. And sometimes families didn't even feel like they could play a role in helping their loved one get the care that they needed. And so things like that, to dealing with people who don't have family members that they can lean on as well. So I think that there is strong bipartisan support to do things that will help Minnesotans in general, for sure.
If you could say just one thing that you learned from this task force that you know will stick with you, what would that be?
Well, I learned a lot about IRTs, which are housing for people who are more or less in transition from leaving the hospital to going back to their regular home. And I think that if we look at housing so that we can stop that log jam and work with communities so that we can find the right kind of housing fit that'll work for people, I think that that will help address that streamlined process that we can hope people move on. And I know in other states they have some other types of housing programs that maybe we could follow as well. I have a personal story. I have a sister who's been suffering, or excuse me, not suffering, but has been dealing with mental health issues for over 40 years. And so we've seen a huge transition of what it used to be way back then to what it is today. And we certainly have moved considerably forward over those decades. But I look at how we're going to work with her as she gets older and her family grows up and find out what might work best for her. So this is a personal issue for me as well as it is for a lot of other people that I know that deal with these issues. So I'm very hopeful.
Representative Peterson, I want to thank you so much for your time today.
Thank you.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Loehrke, and on behalf of all of us at Senate Media Services, thanks for watching.